Sometimes people have health conditions that need monitoring regularly, but that doesn't necessarily mean they have to be in hospital. Vitaline is leading the field in the area known as Telehealth, which is revolutionising how health professionals can care for people. Technology installed in the patient's home makes it possible for health workers to remotely monitor the condition, whether it's blood pressure, blood sugar levels, oxygen, heart rate, or other important readings.
Every day the machine talks to the patient, and each morning it'll say to the patient, it's time to take your vital signs. So the patient will sit down, put the blood pressure cuff on their arm, put the probe on the finger and simply press a button. The blood pressure will be displayed, the heart rate will be displayed and their oxygen levels. They'll then stand on the scales and it will display their weight. It also asks the patient questions, our set questions. Have they experienced any chest pain? Are they experiencing any difficulty in breathing? And are their ankles more swollen? Which are all signs and symptoms of heart failure. So you can actually set those questions accordingly to each patient and their illness.
These results are then automatically sent digitally and assessed by the Vitaline Telehealth Centre staff. If a patient's condition changes and it's a cause for concern, then staff are alerted and medication can be adjusted accordingly.
I actually receive a printout twice a week as well of all the trends. So if the patients don't actually have any alerts, I'll still have a printout sheet that I will obviously analyse twice a week. So for example, if the blood pressure is rising and I see a constant trend of a raised blood pressure, that indicates that their anti-hypertension medication needs increasing. A lot of the patients as well have become more aware as well regarding their health status.
What differences have you noticed since you began using telehealth?
The biggest one is peace of mind, because it gives me my readings every day, so I can go and carry on with the rest of my life, if you know what I mean.
Do you feel better informed about your condition now, and if so, why?
Yeah, I do feel better informed because I get my readings daily, so it allows me to get on with my life without too much trouble.
Just how easy is the equipment to use?
Oh, it's very easy because they actually tell you what to do and there's plenty of time to do it, so there's no need to panic when she asks you to put the blood pressure thing on. You have got time to actually do it. I've been on it for some months now and it's not been an inconvenience. It's it's probably saved me having another heart attack.
What does this mean for the health service? Fewer visits or call-outs for doctors, nurses and ambulances, and more hospital beds for patients who need urgent treatment, and makes more doctors and nursing staff available for other areas of healthcare.
Well, I've noticed it has a big impact. Certainly for my patients, they're not visiting the GP surgery as often as that they did before. And also, obviously, because I'm keeping the patients well and they're not actually reaching a crisis point, i.e. where they'd have to be admitted to hospital, it's saving hospital beds, isn't it?